with providing these services to individuals? Is there barriers from a policy standpoint? Are there barriers from a social kind of attitude standpoint? What kind of barriers do you guys see that prevent you from impacting the community in the most way that you can?
For me, what I see when we do our outreach and such is the social economic, problems as far as people being afraid to not have that insurance and the money to be able to get any of this done, and trying to let them know that they don't have to have that money. We can cover them. Also, it's an interesting, how much information, what kind of process is it? It's seriously a 2-minute phone call of calling us. We get your name, address, phone number, a little bit of background information, and then that's all we need, and we can help cover anything you need. I don't need your W-2s, I don't need your bank statements, none of that for these screenings or these diagnostic testing. So it's just getting people back involved into the healthcare system, re-engaging them into, because a lot of these people who have not had their screenings aren't engaging with their healthcare providers. So they're not going for their yearly checkups because they don't have that ability to do this. And we're able to help them get back into the healthcare system. So
Absolutely. And Vicky, while we can, somebody who may receive a cancer diagnosis, there's a lot of things that go through their head. It's a huge diagnosis, and it can be terrifying at times. So Vicky, how do you kind of navigate that question or kind of navigate that conversation where, like, yes, you received this diagnosis, but here's what you need to focus on right now. This is what your process needs to be in the time when you can.
So each person is a unique individual. So everybody's fears and worries are totally different. So that's the role of the navigator that meets with them to kind of say, what is first and foremost for you that you are afraid of? What can I help you first? So a lot of things that we do is just like you said, those barrier assessments. Do you have issues with transportation? And if they do, we find transportation resources. If they're worried about losing their job because they now have to go through surgeries and treatments and that kind of stuff, we work with them to get the paperwork they need to get their provider covered. Financial issues are a huge thing for people because if they can't work, then they lose that income. Or, if they do have insurance, if they don't have the Medicaid Cancer Treatment Act, a lot of insurances have high copays and deductibles. So we help work with patients to kind of decrease that financial toxicity that can happen with chemotherapy. And, one of the biggest things, like you said, is fear of the diagnosis. Cancer's scary. You hear that word and it's not always a good thing. I mean, it's never a good thing. Cancer is not a good thing. But, for us to say, we've got you, we know what we're doing here. We've got you. So trust that we're going to get you through this process quickly. You're in great hands. We have medical oncologists here that are experts in their field. We have radiation oncology here that's experts in their field. We have surgery right here. So we are truly a multidisciplinary cancer center that offers all the great medical science behind how to treat cancer. But what people don't really know is we have all of these great support services. Like I said, I'm just one of 3 nurse navigators. We have a health psychologist and a mental health counselor that people can see. We have a boutique here that is free of charge for our patients. So if they have to go through chemotherapy and lose their hair, we can get them a free hat, wig, head covering, whatever they need. We also have massage and Reiki services right here for our cancer patients. And that's based on their income is how much they pay. Both of our therapists are oncology certified, so they know how to treat our patients. It's a great modality for reducing stress. We have nutritionists, we have geneticists, we have social workers, and we have a phenomenal group of nurses here that are very well trained in how to manage